From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about the advancements in treatment of lung cancer and segmentectomies. Our guest today is Dr. Blair Marshall, a thoracic surgeon here at SMH. Dr. Marshall, thank you so much for being with us.
Thank you so much for having me.
So can you start by talking about lung cancer itself and who needs to be screened?
Sure. So, lung cancer actually causes more deaths than right now breast, colon, and prostate cancer combined. So it's very lethal. And we knew that a long time ago. And so people tried to diagnose it earlier. And they did a screening trial. At the time, we just had x-rays. And it turned out it didn't improve survival. But now that we have CAT scans and we can identify nodules that are much smaller that we can't see on a chest x-ray, we did another screening trial. And that demonstrated a 20% improvement in survival in patients with lung cancer who were screened.
So how does the actual screening work if someone is referred by their physician to be screened?
So it's a low-dose CAT scan, so barely any more radiation than you get with a chest x-ray. And it can see nodules, and then typically, depending on how worrisome they are, we might follow them versus recommend an intervention. To find out if you're a candidate for lung cancer screening, you have to meet certain criteria. Basically, to have smoked for over 20 years and to be between the ages of 50 and 80 and to have quit within the last 15 years. But if you're unsure, you can always go online and Google it, and the criteria are there, and see if you meet the criteria.
The percentage of people who are eligible for screening versus get screened, not enough people are getting screened, right?
No, and it's really quite tragic because there's a lot more people that we could be saving with early stage disease. But the national average of patients who are getting screened is only 4%.
Do you think the misconceptions about lung cancer itself and the treatment deter people from getting screened?
I think over the years, there's been a lot of guilt and blame placed on patients who smoke. And really, tobacco companies design cigarettes that are so addictive. It's amazing to me that people are actually able to quit.
So what do you say to patients, or what would your message be to patients who qualify for screening but are putting it off?
Everyone and anyone, there's nothing better you could do for yourself than to get screened.
As a thoracic surgeon, at what point does a lung cancer patient actually come to see you? Because they wouldn't go to you for screening.
They don't come for screening, but if they have a lung nodule and they're wondering what we should do with it, they can come see a thoracic surgeon. We don't operate on every patient we see, certainly. And if a patient needs to come to surgery, 99 times out of 100, we can do it minimally invasively.
Do your patients typically undergo other cancer treatments before surgery?
So if patients are diagnosed with lung cancer and it may be more advanced, then they might undergo treatments. But most often from the lung cancer screening, we've seen a stage migration to earlier and earlier stages. And so those patients with just a solitary nodule are typically just treated with an operation.
What does surgical treatment look like for a lung cancer patient?
So these lung nodules occur in one of many parts of the lung. And so often, if we don't have the diagnosis, we'll go in and just take a little piece and make the diagnosis while the patient's still asleep on the table. If it is a lung cancer, then just taking a tiny piece is not enough to cure the patient of lung cancer, and we need to take a segmental section of the lung with all the lymphatic drainage and the lymph nodes to give them the best chance of cure.
And that's called a segmentectomy.
Segmentectomy is really for small peripheral nodules, the standard of care currently.
Why is that a good option for patients?
So the lung has 3 lobes on the right and 2 lobes on the left. And so previously, the standard of care was an entire lobectomy. And you could think on the left side, that would be removal of half your lung on the left side. And nobody wants to give up more lung than they have to, although we were born with more lung than we need. And when needed, at times, we can take out an entire lung. But thoracic surgeons really like to preserve as much breathing function as we can. And so a segmentectomy is taking out just a segment of a lobe. So sometimes 1/5 of that portion of the lung.
Is surgical treatment best for every lung cancer patient?
There are patients that the lung cancer might have spread too far for surgery to make sense. Surgery is part of a local treatment.
How do you help patients identify the best surgical treatment option for them?
I typically like to get my patients to the level of knowledge that I have for whatever problem we're dealing with. And so I explain everything. I use a lot of drawings and diagrams, and sometimes I even show them surgical videos of what I'm going to do so that they have a better understanding.
So how does segmentectomy differ from previous lung cancer treatments, like you said, the lobectomy or full removal?
So a segmentectomy is much less lung removed, but still an anatomic dissection where we get all the lymphatics. And we know that lung cancer can spread to the lymph nodes, and so we want to get all that lymphatic drainage.
And why is that better for patients other than just maintaining physical lung?
So it has a lot of downstream effects in your recovery, right? If we take out less lung, there's less function, there's less to recover from. And so many patients are in the hospital a day or two rather than several days. They have less pain because it's performed minimally invasively or robotically. So there's a lot of downstream effects.
With the minimally invasive options now, is recovery, even once they go home, much easier?
I think so. Historically, when we did open techniques, we would have to cut through all the muscles. Today, we just put a port right through. And so I want my patients moving, swinging, moving those muscles. And so I tell people, like, if you play golf, get up and start swinging your clubs. You don't need to go out on the golf course the first day after surgery, but, a week later, can you go putt and hit a few holes? Absolutely.
Do patients who've had this procedure require continued cancer treatment like chemotherapy or radiation?
So it depends on really the stage of their disease. And so we'll get that information when we take out all the lymph nodes. If it has gotten into the lymph nodes, typically they will need some additional chemotherapy or modern chemotherapy, which can be immunotherapy or other targeted therapies.
Can you talk about the benefits to patients of having everything from an oncologist to their thoracic surgeon, everything kind of under one roof, like it is here at the Brian D. Jellison Cancer Institute?
So the wonderful thing about this Cancer Institute is that we have a multidisciplinary group, and we present all patients at our multidisciplinary tumor board, and then talk about what's the best thing for this individual patient based on their information, the stage of their disease, and what their wishes are.
And does that help the patient also with their knowledge and understanding of what's going on with their treatment?
I think patients are very happy to know that everyone's looked at everything together and made sort of a group decision on how best to manage.
Is there anything else you'd like to add?
I would just say if you know someone or one of your loved ones and you think they might be a candidate for screening, to get them screened, because that could have a huge impact on their overall life.
Dr. Marshall, thank you so much for joining us.
Thank you for having me.
As always, we encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.